Hello, I'm Dr. Maria Karakoulaki. I'm an aesthetic and functional gynecologist, and today I will be like to talk to you about labiaplasty. So there are two different kind of candidates for labiaplasty. There are women that face functional issues because of the anatomy of their intimate area, and other women, they will just do it for cosmetic reasons. So functional issues when the labia minora mainly is enlarged are maybe recurrent infections like vaginitis, vulvitis. They will find difficulties in some kind of exercises like bicycling or horse riding. Also during intercourse that might cause some difficulties. So for that reason, someone would like to have the enlarged labia minora shortened, and that's a reason to do the labiaplasty. Or there are other women, they just want to correct the appearance of their intimate area because the labia are maybe not symmetrical, one is bigger than the other, or it's too big, and they are just seeking for a better appearance, and that's the reason why they will come and they will have the labiaplasty. So labiaplasty is a very delicate surgery. It's a surgery where we have to look into detail, and for that reason we use advanced technology to cut the skin, like radiofrequency, and that will give the best actually cosmetic result without any scar. And also the healing process will be easier. And we do use sutures which are very fine, they are almost invisible, and they will be absorbed by our own body, so we don't need to remove any sutures. What a woman should expect after a labiaplasty, if she did it for a functional reason, is less infection and more comfortable intercourse, no pain during intercourse, and of course doing the exercises without any limitations. And then in regards to cosmetic result, we do expect a symmetrical labia, and in order actually to achieve that, sometimes we have to do also clitoral hood reduction. Clitoral hood is the skin in front of the clitoris. And sometimes when you reduce the size of the labia and you leave the clitoral hood without any intervention, without any reduction, the result is uneven, it doesn't look nice. So that's why we like many times to combine the two surgeries and have a labia minoroplasty plus a clitoral hood reduction. So if you're going to have labiaplasty, it would be advisable to stop taking any blood thinning medications like aspirin, for example. Also some supplements like omega-3, it's better to stop it a few days before. And it would be highly recommended also to quit smoking in case that you're a smoker, because smoking really affects the healing process. And a non-smoker patient will heal much better than a smoker one. So labiaplasty, like every surgery, can have some risks like infection, which is very rare, and bleeding and bruising. But they are minimal complications, and usually after a few weeks they will subside. So the labiaplasty will be done either under local anesthesia or under general anesthesia, and it takes everything between 1 and 2 hours, depending on what kind of work has to be done, and also if we combine the labiaplasty with the clitoral hood reduction. If the labiaplasty will be done correctly, the sensitivity of the area shouldn't be affected by the surgery. The recovery time after labiaplasty is approximately 4 to 6 weeks. However, the first week a woman should really take it easy and be careful. I would say that the first 2-3 times you stay at home and you ice the area as much as you can, and after that you can go and have some walks, but not really exercise. So we do advise for at least 4 to 6 weeks, or at least 4 and maximum 6 weeks, not to go for swimming, not to have a heavy exercise, and not having intercourse. After the labiaplasty, the woman should follow some certain instructions about how to take care of the wound, and I always like to say that 50% of the job will be done by me, by the doctor who will conduct the surgery, and 50% by the patient, because the care of the wound is very, very important, and therefore the woman should always keep the area dry, clean and dry. Apply the creams that will be given after the surgery. They are regenerative creams, so that the healing will be better. And also be very careful by wearing loose underwear, also loose clothes, so nothing tight. And if in between the woman will get her period, then it's advisable to use rather tampons than pads. So if the healing is completed after 6 weeks and there are no complications, then the woman can go back to her sexual life without any concern, and also to all her routine in regards to exercise and other activities. After the labiaplasty, as long as the skin, the wound has healed, a woman can start again shaving, but she should be careful and not come very close to the labia minora where the surgery took place.